At Kenya's LVCT Health Call Center in Nairobi, workers respond to phone calls and text messages from across the country.
Have you had your periods before?
They say most of the questions are about reproductive health, especially the menstrual cycle. Menstruation is often shrouded in secrecy and shame in Kenya, according to UNICEF. The agency says teenage girls often look for information about it online, but what they find is not always accurate. To help them, the Kenyan government, UNICEF and LVCT Health created Oky Kenya, a mobile app that allows teenage girls to learn about their bodies in private.
It tells them having your periods, that's a normal thing. It's not something to be ashamed of. They'll be able to know where they can get these products that they need, or also support mentally, because some people don't know when they're having their periods. They will wonder, like, why am I receiving blood?
You know the tension, like, alafu.
Cecilia Loku is one of more than 8,000 people using the application. Loku, a mother of one, says her teenage pregnancy could have been avoided if she had received the information available on the app.
If I had that information, like this app, it can predict my periods, my safe days. When I'm ovulating, I will be pregnant or I will be a mother of one right now.
According to several healthcare organizations worldwide, abstinence, refraining from all forms of sexual activity, is the only 100% effective way to avoid pregnancy. Various forms of contraception, such as using birth control pills or condoms, also greatly reduce the odds of conception.
Premenstrual syndrome, let's go to pain.
Oky Kenya users can not only track their menstrual cycles on the app, but also text or call mentors and learn about reproductive health rights. Kate Kiema is Director of Programs and Impact at She's the First, a US-based girl support organization that works in Kenya and supports the app. She says innovation such as the app is needed in a society that shies away from discussing sexual and reproductive health.
Mentors are particularly shy to talk to girls about whether it's puberty or whether it's about menstrual hygiene. So you can imagine if a girl is coming from a community who think periods is such a taboo, this girl doesn't have anyone to explain to her this is a natural biological process.
An average of 4 in 10 girls in Kenya are pregnant or have had a child, according to the Ministry of Health. In a telephone interview, the ministry's deputy head, Janet Mule, said poverty and lack of education, especially in remote areas, aggravate the cases. The state established a 10-year reproductive health policy in 2022 that outlines actions to reduce teenage pregnancies, such as promoting knowledge about menstrual cycle and the use of contraception. Kenyan authorities believe tools like Oky Kenya app will help teenage girls get the information they need. Victoria Amunga, VOA News, Nairobi.